Good evening, everybody out there, all the students of Conceptual Anesthesia. So my name is Dr. Saif, and I am an intensivist and an educator as well. And today's topic is relevant to all of you who are going to appear for exam, who are in the training of anesthesiology or training in the critical care. As you know, that this is the important topic for all of you, the management of COVID-19, which has not completely finished. This pandemic is still going on in a sporadic form. There's an outbreak everywhere and now and then. So you are supposed to know about COVID-19. This is the necessity. And as you know, this has been a great pandemic of the century so far, taking lots of precious lives across the nation. And India was hit by this pandemic in March 2020 when nationwide lockdown was announced and we were at the forefront to fight a war. And hence, we were called COVID warriors, many of us saving numerous lives and also losing several ones. In this meeting, I'm going to cover the latest guidelines and advances in COVID-19 management, especially the severe COVID-19 management which we are concerned in, which we are always taking care of in ICU settings. And we will start with the typical case. So this is the case of 68-year-old male with comorbidities, included uh, diabetes mellitus and hypertension. And he presented with a history of fever, cough, and diarrhea for last 5 days in emergency department. He has a desaturation. He was tested positive for COVID-19 via an antigen test. And later he was admitted to isolation ward. But there he did not improve in isolation ward, and even he progressed over 10 days. Clinically, radiologically, he worsened, and therefore, so this is the X-ray over next few days, next 10 days, and as you clearly see that chest X-ray infiltrates are worsening. So he was admitted to ICU. He was started on respiratory access device for his hypoxemic respiratory failure, and later, due to worsening dyspnea, a respiratory rate exceeding 30 breaths per minute and a ROX index below 3.851, he was his trachea was intubated and he was hooked to mechanical ventilation. So this is a typical COVID-19 case which became severe and critical. And now based on this case scenario, you can have some important questions which can pop up in your mind or examiners might ask you also in exams like what are the ventilatory settings which could help in this patient? What should be the optimal fluid management strategy? What was the role of BiPAP and efficiency in this case and how it failed and when would you consider a tracheostomy in this case? Okay, suppose the patient remains intubated for next a week or so on. Or a role of antiviral, would you start antiviral in this particular case? Or there is a role of steroid, as you know. Steroid is very helpful, but we will deep dive in to the discussion of using the steroid and other, anti-inflammatory drugs and the role of anticoagulant, role of plasma therapy. Okay, so all these questions. But before all these, challenges, there are few basics to be covered. First of all, that you should know that this is a flu-like illness which affects uh, various organ systems in the body, prominently lungs, but other organs can also be affected. For example, the CNS. Okay, there have been multiple cases where we found the muscle weakness. Okay, especially after the episode of diarrhea and COVID-19. So, patient developed the GBS-like illness, Guillain-Barré syndrome-like picture. So we had those kind of, typical presentations where COVID-19 was detected as a part of testing, okay, for flu-like symptoms and or even diarrhea. but it was associated with neurological symptoms, and sometimes it was associated with simply the multiple organ dysfunction syndrome or the leak syndrome, etc. So there have been multiple symptomatology. So this is reason we should have a full clinical the knowledge of full clinical symptoms and signs. So so you have to always doubt clinically whether patient may have some COVID-19. So there are some typical symptoms, as I said. So you can categorize the disease into mild to moderate and severe critical illness. Okay. So mild disease without any evident pneumonia or just low grade fever or slight fatigueness could be a mild COVID-19. In moderate cases, what would you say that the patient has moderate COVID-19? When would you say? When there is a drop in saturation, but still the saturation is more than 94%. Okay, but it is dropping a little bit, or maybe having persistent fever or extreme fatiguability, a dry cough, okay, diarrhea, all these symptoms may fall into the category of moderate COVID-19. Then you have a severe category. So these are clinical categories of COVID-19 as per IDSA guidelines. So IDSA is Infectious Disease Society of America. So we follow the guidelines, all the national guidelines are based on this international guideline agency, IDSA. So IDSA has given the first guideline for management of COVID-19 in 2021. And then there have been many updates, so you can refer to. So this presentation is basically based on IDSA guidelines and CDC, that is Center for Disease Control guidelines. So I have referred these two authentic sources uh, to get the latest information, latest update for COVID-19 management. So severe disease means that patient has saturation less than 94% on room air or needing low flow supplemental oxygen. So that is your severe COVID-19. Okay, but it's still not critical. In critical condition, the patient will require the high flow oxygen therapy or BiPAP or NIV. So that will become critical COVID-19. And sometimes you have to go uh, to the extreme, invasive respiratory support like invasive mechanical ventilation or ECMO. So in our case, in the case which I presented, we went up to intubation. Okay, means the patient was can be labeled as a critical COVID-19. Okay, so for us, severe COVID-19 and critical COVID-19 are the disease category which we take care of in ICU. All right. So how will you confirm? How will you detect it? So what are the diagnostic tests are available? So there are only two categories of tests which are important. First is the COVID antigen test. As you know, this is a rapid antigen test. It is a point of care testing where we put the sample onto uh, the kind of script, and we just see the color, okay, and when we see whether this color is changing, and we label it as a COVID-19 positive. This is very rapid test, okay, and it basically detects the presence of specific viral proteins, okay, and when it is positive, suppose COVID antigen test is positive means this is very highly specific, okay, for the COVID-19. But sensitivity is less. Suppose the test is negative, you cannot rule out. You cannot rule out COVID-19. This is the reason we need more confirmatory tests like PCR based test or respiratory panel. Okay, or otherwise known as NAAT. What is NAAT? Nucleic acid amplification test or simply PCR. So this is more confirmatory and it takes time about 3 hours to sometimes 1 or 2 days, where you can rule out the COVID-19. Okay, so suppose this is negative, means definitely patient is not suffering with the COVID-19. But suppose not is positive, you may not be very, you can, be sure, okay, but sometimes there could be false positive results, like the